It's Columbia Morning on KFRU. I want to introduce you to one of the persons who has been involved in the meetings, been involved in the preparations, in the response, and continues to be so right now. And this is the I've got to get to her official title, because if I don't, I won't forgive myself. She is the Chief Nursing Officer at MU Healthcare and has so many other responsibilities right now. Mary Beck joins me. Mary, it's good to talk to you. How are you?
I'm very good, David. Thanks for having me on today.
So what other responsibilities are you carrying right now? I mean, nursing is enough because you have to deal with those who are on the front line, who are dealing with this every day and the uncertainty of it. But what else are you doing now?
So if I could just say, not only dealing with the folks that are presenting with symptoms of COVID-19 and or our patients, but also with the majority of our patients that need have other usual illness that are admitted in the hospital right now. So maintaining that level of care is also a responsibility we have. But my other responsibility is as the co-incident commander for our incident command system, because this was declared an emergency, not only in our local hospital, but as it has been in Boone County, the city of Columbia, the state of Missouri, and across the nation.
I was curious, and I'm glad you started with what you said, because you said we got patients that are in the hospital for things other than COVID-19, and that would be the majority of the patients right now are not in for COVID-19. But how does what happens as far as COVID-19 is concerned impact the other work of the other nurses? And I guess by that I mean, do you reserve the nurses that are only going to work at the COVID-19 bedsides and the others are not? But I can't imagine that it's not impacting an attitude or approach to work for everybody.
Right. It does. It's our nurses, our housekeepers, our nutrition, everyone has a fear factor just like everyone else because this disease was so unknown. It's new. But we really early on created the path of the patient. And how do we make sure that we have a path through the hospital from the time they come in through the emergency department or come directly to us from, say, a clinic or another hospital? But what is that route so that we make sure that everyone stays safe? And then we have a dedicated ICU for if they're critically ill, and we also have what we're calling our medical surgical unit for COVID-19 patients that are less acute and don't need that ICU level of care. But we can convert that unit very quickly to ICU level of care if we need to in the future.
About how long are patients that are tested positive for COVID-19? And I know that the university, I really like what they started doing a couple of weeks ago, releasing updates of the number of inpatient COVID-19 positive patients and those who are pending, whether they have a COVID-19 positive response or not. But what's the recovery like at MU Hospital?
So if you're in the critical care unit, and the problem is patients that end up in the critical care typically have very bad lungs. And they get what we call acute respiratory distress syndrome. That can be a week or two on a ventilator, and then the recovery after that, because you become very weak, it's going to be a long recovery. They could be in the hospital for another week after that, and then are going to need therapy, most likely, a lot of strengthening to get back on their feet and going again.
The numbers, do you feel that they're fairly accurate, what's being reported now, or do you have a hunch that maybe some are more than what we've seen so far in the reports daily?
So, there's probably more cases in our community, state, nation than we know because of the limited testing that we have available. We're not testing everyone. But I think for the testing that we're doing, it is very accurate. We have a daily situational awareness data bank that we're looking at, not only locally, but we can look at every county around us. And we are a catchment area for about 29 counties. So we are paying very, very close attention to what's going on. But I think our numbers are pretty darn accurate for what we have local.
Help me understand. I've tried to get my mind around this, and I imagine there are others maybe who are listening, but just help us understand. We hear the stories that, I would use the word, and I use it with thinking behind it, like the horror stories, especially out of New York City. And there are other places. I think Detroit is, and some places in Louisiana, and some on the West Coast, especially early on. Those are not the situations here. but we are doing, maybe we have succeeded learning from them to keep that from being a situation here? Or is there the thought that that still is a potential to be what it's like here?
So we have the gift of time in mid-Missouri. That's one of the good things about being flyover country, is what I like to say. We have the gift of time because the coast is where, you had this influx of people into New York City, into the West Coast, and we don't have a dense population. So if you think about, we stood up our incident command center, actually February 24th, we started using it just for our resources of the personal protective equipment, which includes masks, which is what everyone's most concerned with. And then we stood up our full incident command on March 9th. So we have done extensive planning not only for the low numbers of patients that we have at this point, but we have an entire plan that could take us to many hundreds of patients with COVID-19 if the need arises. We think that's the worst-case scenario, but we're ready. We're ready if it does arise.
I guess I should ask you, since you are the one that's working with this so closely, as far as supplies and masks are concerned, how is that supply at university hospitals?
At this point, we say that we're adequate, but it's a matter about using the right mask, personal protective equipment in the right scenario. So we've given every frontline clinical person that's touching patients an N95 respirator, and they will have access to more, but we also can reprocess those. So we've set up I'm so proud of our supply team and our folks in our maintenance and sterile processing that have set up systems where we can repurpose the mask, which is a good thing to do at this time, because we don't know the long term what that supply chain will be. We also gave every frontline person a regular universal mask, and this is really for those that we call them the duckbill mask, but they really, if they want to wear it throughout the day, they can. And then again, we can repurpose those masks. But we're always, our supply team, I'm so proud. They are working all the time with vendors across the country, across the world, trying to say, how do we get more equipment? How do we make sure that we have enough supply for the long haul? And I think that right now, though, the government has stepped in, and they are moving some equipment to areas where they've had large volumes of patients. And so, we just have to be good stewards right now to make sure that we're good for the long term.
Mary Beck is our guest. Just a couple of more questions for her, Chief Nursing Officer at MU Healthcare. How do you personally, but then also the others who are leading the efforts of trying to stay on top of this, making the right decisions, preparing, responding, how do you process everything that is coming your way every day?
That's the one great thing about having the incident command system, is we have what we call, the way the whole structure is set up so that we have people responsible for certain areas. So we have a logistics chief, and that's supply chain. We have a planning officer that's looking at what is that path of the patient, what about the number of masks that we're going to need if we have X number of patients. Also the staffing plan that goes with that. We have a public information officer. We have our liaison that works with Boone County, that works with the state. So those people, we have our lanes, that we all have our lanes to work in, and we need to make sure then that we're doing the right work in our lanes and contacting the right people, so that we have a briefing twice a day. So at 8 a.m. this morning, we'll have a briefing with all the section chiefs, and then again at 4 o'clock today. So and there's a lot of work that goes on in between, but it really is about having the structure that allows for efficient work and the right people doing the right work.
You told me off the air that you've been in nursing for a very long time, but this is unlike anything that you've ever faced or witnessed before.
That's true, David. 43-plus years as a nurse, and it has been the most challenging. I want to make sure that we're doing the right things for our staff every single day. We have to keep them safe, because if they're not safe, then they can't take care of patients. And so that is our absolute priority.
And you would like, hopefully, I'm going to ask, would you like to leave us with something? Would you tell people who are outside of the medical community who feel like they've been untouched by this to understand that this is something different. This is not the typical flu or anything like that. This is something that still has a lot of danger to it.
It sure does, David. And I do want to tell everyone that the shelter in place is the right thing to do. It is absolutely the right thing to do so that you're not having the incidental touch of someone that then can spread to others. We have to keep our community safe, and the only way to do it is to wash your hands, stay home, just do the right things. And my big thank you is to those essential workers, not only in our healthcare, but I'm so grateful for all our nurses and providers and housekeepers and maintenance men, all of those, everyone here, and all the health systems, but also to all our law enforcement and the people that are driving the trucks to bring the food, the grocery stores. It's really every morning I hear this ad on the radio or on TV. That's the song, The Heroes, and it just moves my heart. And I'm just so grateful for everyone.
Well, we're grateful for those who are like you, who are doing this and making some tough decisions and helping us to be prepared for this. And especially, like you just said, all those who work in so many different roles that we're not even aware of. I think we're being tested for our patience right now. I know it's an itch and urge to get things back to normal as quickly as possible, but there is danger in not listening to those who are on the science front lines and on the medical front lines and hearing what they have to say like you just did. So thank you, Mary.
You're welcome, David. Have a nice day.
All right, you too. Mary Beck, who is, again, Chief Nursing Officer, and she's the co-incident commander working on the issue of the coronavirus and COVID-19 for this community from MU Healthcare. You're listening to Columbia Morning at KFRU.